الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين والعاقبة للمتقين والصلاة والسلام على رسوله الكريم سيدنا محمد وآله وأصحابه أجمعين برحمتك يا أرحم الراحمين. All praise due to Allah, the Lord, cherisher, nourisher, sustainer and master of the universe, the most gracious, the most beneficent, the most merciful. Ya Allah, it is only you that we worship and it is your guidance that we seek. Ya Allah, keep us on the straight path. Ya Allah, show us the choice of blessings. Ya Allah, show us your mercy. Ya Allah, guide us. Greetings, salam, salutations on our beloved Nabi Muhammad Rasulullah Sallallahu Alaihi Wasallam. It's time for Medical Files, brought to you by the Islamic Medical Association of South Africa and hosted by myself, Faisal MJ Sulaiman. Assalamu alaikum wa rahmatullahi wa barakatuh. And we welcome our listeners on Radio Al Ansar, CII Radio, Voice of the Cape, Radio 786, Sirius FM, Radio Islam, and IFM Port Elizabeth, as well as all listening to us on audio streaming and other platforms. Our topic for discussion is osteoporosis and fractures, and our very special guest this evening is Dr. Mohammed Manjra, an orthopedic and arthroplasty surgeon practicing in Durban. Dr. Manjra, assalamu alaikum wa rahmatullahi wa barakatuh, and jazakallah khair for joining me on the program this evening.
Wa alaikum salam wa rahmatullahi wa barakatuh, and thank you very much for having me. It's always fun to be here.
Absolute pleasure. Now, Dr. Mohammed Manjra is a dual fellowship trained orthopedic and arthroplasty surgeon specializing in reconstructive, restorative and replacement surgery of the hip and knee. He is currently in full-time private practice at Ahmed Al Qadi Private Hospital in Durban and holds a part-time senior specialist post at the hip and knee unit of Nkosi Albert Lutuli Central Hospital, which hospital serves as a referral center for the most complex and challenging issues throughout KZN and surrounding provinces. Dr. Manjra matriculated at the Westville Boys High School in Durban, earning his full academic colors, then departed to Johannesburg to earn his medical degree at the University of Witwatersrand in 2009. Dr. Manjra then went on to complete his orthopedic specialist training and master's degree at the Steve Biko Academic Hospital, University of Pretoria in 2018. During his training, Dr. Manjra was recognized as a future leader in the field of orthopedics by being selected to travel around the country as part of the Smith and Nephew Traveling Fellowship. Dr. Manjra then traveled to Cape Town, where he worked as a consultant orthopedic surgeon at Tygerberg Hospital in the Trauma and Sports Orthopedic Unit. During his time there, he had the honor of performing the first total hip replacement at the Karl Bremer Hospital. In mid-2019, Dr. Manjra commenced subspecialty training by first completing the Tygerberg Hip and Knee Arthroplasty Fellowship, which involved one-on-one mentoring with Dr. Koos Jordan in complex hip and knee surgery, the anterior approach for total hip replacement surgery, and robotic knee surgery. In 2021, Dr. Manjra then traveled to Toronto, Canada to complete a hip and knee reconstruction fellowship at the Sunnybrook Holland Orthopedic and Arthritic Center through the University of Toronto. This center is one of the largest volume joint replacement centers in Canada, performing up to 2,500 cases per year, with the University of Toronto ranked amongst the top three global universities for surgery. During his training, Dr. Manjra has participated in several research studies related to orthopedic trauma and joint replacement surgery and has received numerous awards both locally and internationally. He has published papers in both local and international peer-reviewed journals in the fields of orthopedic trauma and joint replacement surgery. When he is not working, Dr. Manjra maximizes his time with his family and can commonly be found on the weekend on board a bike or board on the Durban beachfront or a mountain bike trail. Whew, I thought I asked for a brief resume, Mohammed. Anyway, as our topic for discussion is osteoporosis and fractures, and let's just dive into it, Dr. Manjra. What is osteoporosis and how does it affect the body?
Right. So I think one of the most common misconceptions or misunderstandings people have is what osteoporosis is. And the condition which it is most commonly confused with is osteoarthritis. Mm-hmm. So let's just dive in a bit into the linguistics behind it. So osteo means is Latin for bone. So anything which says osteo, it refers to bone, okay, right? Now, the difference between osteoarthritis and osteoporosis is osteoarthritis is a degenerative condition which actually involves the joints, not so much the bones. Osteoporosis is a condition which affects the bones. And what happens in osteoporosis is that the quality of your bone is diminished, right? So normally your bone will be nice and thick and dense, When you have osteoporosis, the bone becomes thin, porous, and brittle. And as a result, as you can imagine, your risk of breaking the bone, or in other words, getting a fracture, increases. And there's many different reasons for that. This can be due to age, most commonly, hormonal changes, or vitamin deficiencies.
Just remind our listeners, this is an interactive program. If you have any questions on osteoporosis or fractures, you can forward them to us via WhatsApp on 060 904 1056. I repeat, 060 904 1056. Now, Mohammed, you did mention that with osteoporosis, the risk of developing fractures, etc., are increased. You just elaborate on that. So, what are the risk factors involved?
Yeah. So risk factors for osteoporosis, I'm assuming you're asking. So the most common risk factor is age. So as we age, our bone density tends to decrease, especially if we don't remain active, especially during resistance training. Our bone quality and density tends to diminish. Other risk factors involved is if you've got a family history or some sort of genetic predisposition within your family where you have osteoporosis. Also, another thing that's commonly associated with osteoporosis is when you have a low body mass index, right? So on the extreme, you have if you're overweight compared to your height, you have a high body mass index. If you have a low body mass index, you have a higher risk of osteoporosis. And there's certain external factors which can also be associated with osteoporosis, such as smoking, excessive use of alcohol, lack of exercise, and an inadequate calcium or vitamin D intake, especially, amongst our ladies who may not spend enough time in the sun. Their vitamin D levels are often very low, which then predisposes them to developing osteoporosis.
This is the first question that's coming.
Already.
Salams, what's the best treatment for osteoporosis?
So the first thing you need to establish is what is the cause of your osteoporosis, right? Is this what we call primary osteoporosis, which is the normal osteoporosis associated with age? Or is this a secondary osteoporosis? For example, if you've got some sort of medical condition or hormonal imbalance, which is leading to the osteoporosis. So I think the first thing is to establish the cause, right? Now, if you've got a secondary osteoporosis, you have to address the underlying cause, right? Because there's no point treating the symptoms, which is the osteoporosis. You got to treat the underlying cause, right? So you got to correct those hormonal abnormalities or treat the underlying problem. Now, more specifically to the question, primary osteoporosis, how do you treat it? How do you prevent it? I think the best treatment is prevention is better than cure.
Okay.
So, following a healthy diet, high in calcium, vitamin D, getting enough sunlight, and getting enough exercise will go a long way in improving your bone health and your overall health, and slowing down or preventing osteoporosis. And I think there's a misconception that people should be doing more aerobic or cardiovascular activity, but in actual fact, what people need to do is do more resistance training. So I'm not saying you need to pump heavy weights in the gym, but any type of resistance training using bands or cables or machines or even free weights or even your body weight goes a long way to strengthening your bones and also strengthening your muscles, right? And then again, as I mentioned before, a diet which is rich in calcium and vitamin D is extremely important in maintaining that calcium and bone homeostasis. Right.
In fact, the two questions that came through, the next question was, what do you suggest we take? And you spoke about the diet.
Yeah. So we discussed
the next question is supplements.
Supplements.
Lots of us take supplements. That's the question. Say,
right.
For your bones, to strengthen your bones, etc.
For sure.
Your thoughts?
Yeah. So I think again, prevention is better than cure. And I think a lot of modern day diseases can be, I wouldn't say avoided altogether, but we can treat them better if we follow healthier lifestyles. So definitely diets, supplements which contain vitamin D and calcium are essential, especially if you don't get enough sunlight. And then, spending time in the sun, I think is extremely important. I often tell patients, at least go and purposely spend about 30 minutes in the sun per day.
30 minutes?
20 to 30 minutes.
Oh, okay.
And not through a window. You need direct sunlight on your skin.
Yes, absolutely.
Yeah.
Absolutely. Now, how prevalent is osteoporosis in South Africa? And who is most likely to be affected?
So definitely women are much higher risk of developing osteoporosis for various reasons, and a lot of it comes down to cultural things such as covering up, etc., and also genetics, and then also hormonal differences between men and women with menopause, etc. So approximately about 1 in 5 women and about 1 in 10 men will be affected with osteoporosis.
Is it? Okay.
Yeah.
So it's almost 10% of the men and 20% of the women.
Exactly. Yeah.
Wow. And symptoms. What's the symptoms of osteoporosis, and what about diagnosis? How do you diagnose it?
So if you have osteoporosis, you often won't even know you have osteoporosis unless you develop fractures.
Oh,
right.
Okay.
So if for example, if what commonly happens is you develop this low energy or almost no energy fractures in your spine, because your spine are these little building blocks, and then you can have deformities and hunched over back, which can cause pain. And obviously if you fall and you break a bone, then you're going to feel the pain. But it's important to remember, unlike osteoarthritis, which affects a joint where you have pain in that specific joint, and following the pain you'll have deformity and then dysfunction and loss of function, you may not know whether you have osteoporosis. Therefore, it's important, as how do we diagnose it, right? So I would certainly encourage women over 60 to either seek professional help with regards to diagnosis, or to at least get what's called a DEXA scan done, right? So a DEXA scan is a bone density scan, right? So what this does is it measures the density of your bone, the quality of your bone at certain sites within the body. So it measures it most commonly in your hip and then in your spine, and then that measures the quality of your bone against matched cohorts. And then you have different scoring systems which will either put you into a normal bone category, what we call an osteopenic category, where your bone is weak but you haven't yet developed osteoporosis, or it puts you into an osteoporotic category where your risk of osteoporosis is significantly high, and they suggest maybe going on to treatment. So the DEXA scan is sort of the gold standard with regards to osteoporosis.
Okay, another question's come through. Assalamu alaikum wa rahmatullahi wa barakatuh. Jazakallah khair for an excellent program. Can an accident causing major spinal operation resulting in triple fusion result in someone developing osteoporosis? Jazakallah.
Okay, so that's an interesting question. So I think that the listener was involved in a vehicle accident, if I understand correctly.
Yes, so.
Obviously, for them to require a triple fusion, they have to have had a very severe spinal injury. And they want to know whether the injury and the surgery can specifically cause osteoporosis. And I think the answer is probably no. I don't think trauma or surgery will directly cause osteoporosis, but there may be other factors involved. Maybe, the individual is not as active as they were before, may not be in the sun as much. Their diet may be different, and that may be secondary cause of osteoporosis. But trauma and surgery itself, from my knowledge, will not cause the osteoporosis.
Thanks a million, Dr. Manja. Just to remind our listeners that doctors and guests on the Medical Files program will help you with any medical problems you pose by giving you advice on air. However, they do not have your full medical history and have not examined you. Please verify the advice given to you on air with your regular doctor who knows your medical history, your allergies, etc. Neither the doctor nor the relevant radio station nor the Islamic Medical Association of South Africa will take any responsibility for any adverse reaction caused by the advice given on Medical Files. Also, to remind you that this is an interactive program, and if you've got any questions for Dr. Manjra, then you may forward them to us via WhatsApp on 060-904-1056. Doctor, there's a question that come through. Salams, I didn't get this right. Salams, I have blue veins. I have it thick and dark blue. Can it just be cured? I didn't get that.
Okay, so I'm assuming these veins are on the lower limb, right? So it can be one of two things. I don't think this is either related to osteoporosis, but nonetheless, I mean, when you have thick veins on your lower limbs, these are what we call varicose veins, is where the veins lose their valves and their ability to pump blood up. That's why the blood pools and it causes dilation of the veins. And if they are concerning, and if they are especially causing problems and pain, then you should probably seek the assistance of a vascular surgeon, and they will be able to assist you with that.
Okay, the next question, Salams, I have a constant muscle pain behind my knee areas. Doesn't go away. What could that be?
Does not give us the age? No.
No
Okay.
age.
Yeah. So pain behind the knee is always a bit concerning. And
Okay, the age is 39 years old.
39 years old. Okay. Right. So pain behind the knee, I think probably if you Google, the most common reason you're going to be told for pain behind the knee, it's called a Baker's cyst.
A
Right?
Baker's cyst.
A Baker's cyst. Yeah.
Okay.
Don't worry.
Nothing to
do with cakes.
Okay.
Right.
Okay. I was just wondering.
Right. So a Baker's cyst, right, is basically a fluid-filled sac or collection, right? So all of us naturally have what's called bursa around the body, right? So bursas are basically small little sacs of fluid, and they allow muscles to move smoothly over the skin or fascia or linings within the body, right? Now, you can get inflammation of these bursas, which causes bursitis, or you can get an increase in the fluid in a specific bursa, which can cause a cyst, right? So we all naturally have the capacity to form a Baker's cyst. So the cysts, which is, the culprit, is located in the back of the knee, and it communicates with what we call the meniscus of the knee, so in the medial meniscus, right? So if you have a problem within the knee, so whether it be degenerative such as osteoarthritis or traumatic where you have a tear of the meniscus, which is one of the most common causes, or if you have an infection in the knee, which is very uncommon, that can cause an increase of fluid within the knee, right? And naturally, hydrostatic, laws will teach you that, the fluid will flow from the area of high pressure to low pressure. So the fluid will want to naturally move from the area of high pressure within the knee into the cyst in the back of the knee. And when it enlarges, then we call it a Baker's cyst, or it was described by the cyst of Baker. Okay. So that's the most common cause of pain behind the knee. Other things that, you need to be aware of when you have pain behind the knee is that, you have got blood vessels and you've also got nerves behind the knee. And those could also be the cause of your pain. We're not really sure. Or it can be the hamstrings tendons, which run behind the knee. It can be any one of these different things. And of course, if it's something that bothers you enough, you should probably have it checked out. And usually this involves at the very least an X-ray, and then most commonly an MRI scan to assess the structures around the knee. And then based on what the cause is, then you can look at various treatment options if required for that matter.
Salams, doc. If the osteoporosis is developed from menopause, how can it be treated?
Right. So there's various treatment modalities for osteoporosis. And I just want to make a disclaimer. Orthopedic surgeons don't treat osteoporosis.
Okay.
So we have great physicians, endocrinologists, rheumatologists who treat osteoporosis. The reason why we need to be very aware of it is that patients often present to us with osteoporosis or the consequences of osteoporosis. So, for example, fractures or pain, etc. So some of the treatments that have been described for osteoporosis, I think the most common one that people are aware of is what's called bisphosphonates, right? So what a bisphosphonate does is that, let's take it a step back, right? In your bones, you have osteoblasts and you have osteoclasts, right? So osteoblasts, they build bone, and osteoclasts break down bone.
Okay.
And just like any tissue in your body, like your skin naturally sheds its skin, your red blood cells, they sort of die off, and you get new ones being produced. Your bone is also a living organ, right? So I mean, we commonly see dead bone, and we think that's how bones look, but that's actually not. Bones are actually living and bleeding structures. So it's a dynamic process, and to have homeostasis or to have well-functioning bone, you need to have a balance between the osteoblast building bone and the osteoclast breaking down the bone. And what the bisphosphonates do is that they stop the osteoclasts from breaking down the bone, so that the osteoblasts sort of tip the balance in their favor, right? If it's specifically related to menopause, then you can look at hormone replacement therapies.
Okay.
That will obviously need to be done under the guidance of an endocrinologist or rheumatologist. And then there are also, various other medications. So parathyroid hormone, which involve parathyroid hormone as well, which is involved in homeostasis of bone, which can be used. But like I said, these need to be done under the guidance of an expert to achieve optimal results. And sometimes, something which may work for somebody may not work for somebody else. So you may be not a candidate for a certain medication. You should look at an alternative. Mm-hmm. So it's definitely, if you do have osteoporosis, the last thing you want to do is not get it treated. So it's important to seek, appropriate medical help and assistance and address the problem, because having a fracture is not the most pleasant thing from what I've seen.
I'm sure.
Yeah.
Another question is, Salams, Doc, what causes restless leg at night and what to take for it?
Well, it's not really my field. But yeah, I mean, look, it from what I know, it can be related to many different things. So I think, neuropathies, vitamin deficiencies, and there are treatments out there. And, if you do have restless legs, it's probably, and it's bothering you enough, you should probably see a neurologist. And, all the disciplines I've been mentioning, such as a rheumatologist, endocrinologist, neurologist, and stuff. All the gists. We're fortunate to have all these disciplines available to us at Amar Al Qadi Private Hospital. And if you need assistance in getting in touch, you can always welcome to contact us, and we'll be willing to help.
Okay, we are discussing osteoporosis and fractures, and if you have any questions on osteoporosis and fractures, then you may forward them to us on 060-904-1056. Another question says, I read that the alendronate has some serious side effects, and that when there is a fracture, it is in the femur. Can doctor comment further on this drug?
Yeah, for sure. So alendronate is one of the more older bisphosphonates. So initially we used to give patients 10 milligrams a day, and then we used to do it 70 milligrams a week, just once a week. And what used to happen is that if you had to sit up for a little while, because it would cause like serious indigestion when you take it. So what the listener is talking about is the specific fractures you used to get in the femur. So as I mentioned before, osteoblasts and osteoclasts. And what used to happen is that because there was so little osteoblastic activity, is that there was too much osteoblast, and the bone would sort of lose a bit of that elasticity that it has, and become more brittle, so to say, for want of a better word. And we saw an increase in these types of fractures in the upper part of the femur, these subtrochanteric fractures, and we used to call them chalk stick fractures.
Okay.
Fortunately, we don't see as much of them here as they do probably, I think, in the UK. But yeah, that is one of the side effects of taking bisphosphonates. But yeah, it's well described, and fortunately, if you have maintain a high index of suspicion for it, often you can pick up the fracture before it fractures or completely breaks, and you can fixate it then.
You're listening to Medical Files, and our topic for discussion is osteoporosis and fractures, and our special guest this evening is Dr. Mohammed Manjra, an orthopedic and arthroplasty surgeon. Time for us to visit the marketplace. We'll continue the program on the other side of this. To stay with us.
Come get our butcher's best for less at Checkers Foods Cowie Park. Enjoy certified halal butchery products like Championship Boerewors Thin, $89.99 per kg. Beef tenderized steak, just $89.99 per kg. And Steakhouse Classic Porterhouse steak equates to 39 Rand per 300 grams or 13 Rand per 100 grams. Deals valid from October 21st to November 10th. Only at Checkers Foods Cowie Park. Now certified by the NIHT, the National Independent Halal Trust, across our butchery, bakery, and deli.
Sunnah a Day, proudly brought to you by Sunpick, 100% pure sunflower cooking oil. Sunpick, cook more with less.
Sunnah a Day. Wash the hands and gargle them out before sitting down to eat.
Sunnah a Day, proudly brought to you by Sunpick, 100% pure sunflower cooking oil. Sunpick, cook more with less.
Imagine this. You're putting together a 7-color meal, from the creamy pasta to the glazed carrots and flavorful onion gravy. This entire meal is made with our 100% pure extra virgin olive oil from our La Familia range, bringing outstanding quality and taste to your kitchen. Shop La Familia 100% pure extra virgin olive oil at any leading supermarkets near you. La Familia, heart of the home.
Welcome to Simplex Radio. Visit our showroom for the full range of car audio. Our TV department carries top brands with quality LED panels, full HD to Ultra HD, and now the experience of Super Ultra HD. Visit our theater rooms and transform your home with brands like Onkyo, Integra, Denon, Boston Acoustics, Yamaha, and more for quality audio visual experience. Now available, full range of home appliances. A one-stop shopping experience. Call 031 306 4029 or Kenilworth Park, 202 Brickfield Road, Overport. Simplex Radio, the name you can trust.
You're listening to Medical Files, brought to you by the Islamic Medical Association of South Africa and hosted by myself, Faisal MJ Sulaiman. Our topic for discussion is osteoporosis and fractures. Special guest, Dr. Mohammed Manjra, an orthopedic and arthroplasty surgeon. And Dr. Manjra, there's more questions that are coming in. Let's dive into them as such.
No problem.
Salams. I have psoriatic arthritis. I'm on 4 methotrexate.
Methotrexate, yeah.
Okay. But my toes are painful. Is there something I can do or I can take to ease the pain? Wassalam.
Yeah. I mean, look, it's important to remember as orthopedic surgeons is that we don't only treat your symptoms, right?
Mm-hmm.
We want to treat the cause of your symptoms. So pain can be from many different sources from your toes. It can be from the joints of the toes. It can be from the tendons. It can be from the bones. So the only way we can actually assess and help you, in a meaningful manner, is to make a diagnosis and then give you treatment options, whether they be medical or medical, what we call non-surgical or surgical options. So I think the main thing is to make a diagnosis. I mean, if you're not in a position to seek medical treatment, then you should maybe just try some over-the-counter pain medications under the guidance of your general practitioner. But that will only be short-term relief. I would encourage you, if you do have symptoms and they'll bother you enough, is to seek medical treatment and get a diagnosis first. So, people often ask, so what's the best treatment for shoulder pain? I mean, there's literally textbooks written on causes of shoulder pain, for an example. So, it's important to not treat symptoms, but rather treat the root cause of the diagnosis, and then go from there.
Mm-hmm. Okay, doctor, I had a femur fracture a month ago. I'm using a walker. Will I be able to walk without it? I'm 75 years old. Thanks for this talk. And continue to say the swelling is not going down. I'm having physio every other day.
Right. So the femur, right, is broken up into various different parts. So the common areas for the femur to fracture in osteoporosis is the neck of the femur. So where the head is connected to the shaft, that area in between. Or just where the neck connects to the shaft, what we call an intertrochanteric fracture, are the common areas where osteoporotic patients fracture. So going to the question, right, there's various different factors to consider as to whether a patient will recover full mobility, right? So the first thing is, how good your mobility was before your injury and your surgery. If you had good mobility before your injury and your surgery, there's a good chance that you should be able to recover to full mobility. Although we do warn patients, especially the older ones with osteoporotic fractures, is that you sometimes tend to go down a functional level. So for example, if you're walking freely, you might need to use a walking stick. If you're using a walking stick, you may end up using crutches. If you're working crutches, might have using a frame. And if you're really bad in a frame, you may end up in a wheelchair. But I think that notion is changing now that our treatment modalities are a bit more advanced. The next thing you need to understand is where did it fracture, and then what type of operation did you have to fix the fracture? Did you have a hip replacement because it wasn't amenable to repair, or did you have a fixation of the fracture and then you have to wait for the bone to heal? So if you had a replacement surgery, usually within a few weeks, a lot of patients are able to walk independently. If you had a fixation surgery where the bone needs to be fixed, now bone healing takes about 4 to 6 months, sometimes longer, right? So the device that would have been implanted is there to take on the load while the bone heals, right? But there's only a certain amount of cycles it'll be able to go through. So it's a race between the implant failing or the bone failing or the bone healing for that matter, right? So there's various things to consider. In terms of swelling, I usually tell patients that you can expect swelling in the entire limb which has had the operation, which has had the injury for many months, up to a year after the surgery, as long as you make sure that there's no pathological causes for the swelling, such as what we call a DVT or clot in the veins, which is holding up the blood flow, or an infection, which is also causing the swelling. Then swelling can be normal. You can mitigate the swelling with a compression stocking. Also with physiotherapy, they have various modalities to help reduce the swelling, especially if you have an experienced physiotherapist who in lymph drainage, they can really help with seriously reducing that swelling, right? So unfortunately, I don't have a straight answer because of enough information, but I hope that, just shedding some light onto different factors to consider, the listener can get a bit of a better idea, right? But also, if after some time you find that you're just not progressing, it may mean that, either the fixation or the replacement may not be functioning correctly, and you need to have that checked out.
The question that comes to his salams, I had total hip replacements on both hips 2 years ago. I would like to know if it's safe for me to use a vibrating exercise machine.
A vibrating exercise machine?
Yeah.
Yeah, look, I mean, if you've recovered well and you're walking fine and you're not having pain, I don't think there'd be any harm in using a vibrating machine. I do advise patients all my joint replacement patients. You usually see them at 2 to 3 weeks and 6 weeks and 6 months, and then every year or every 2 years or so, just for an X-ray. And if your last checkup is fine, then I don't think there's a problem using a vibrating machine.
Okay, salams. For what period should I use bisphosphonates? For what period should bisphosphonates be taken, and what happens once a person stops taking these drugs? And to what extent can osteoporosis be reversed?
Yeah, so taking bisphosphonate medication, you can certainly improve the bone quality and reverse the osteoporosis. In terms of how long they should be taken or what happens when you stop them, obviously, if you stop them, the osteoporosis is likely going to recur. How long you should take them, I think that would probably be the domain of a specialist, such as an endocrinologist or rheumatologist who treats osteoporosis. I wouldn't be able to shed too much light on that, but my understanding is that if you have osteoporosis, nowadays, it's very easy because you don't have to actually take medication on a daily or weekly basis. There's an annual infusion of the bisphosphonates. You come in once a year, you get your injection, and that's pretty much it. So it's become a lot easier to treat than before. So I would assume that even if it's just something, an injection you take once a year, that you just continue taking it. And I think the harm in taking the injection over the harm of sustaining a fracture significantly less. So you rather mitigate the risk of infection, a fracture by taking the treatment.
Okay. Now, can osteoporosis be prevented, or is it an inevitable part of aging?
So I think to some degree, we all will get some degree of osteoporosis, right? But it can definitely be mitigated by exercise, especially resistance exercise, and also by having a diet which is rich in calcium, vitamin D, and obviously, as I mentioned before, getting enough sunlight. So we may not be able to completely avoid it, but definitely you can mitigate it to some degree.
Okay, let's go on to fractures.
Right.
What are the most common types of fractures associated with osteoporosis?
Right. So the most common ones, certainly, and this is no specific order, any bone can break from osteoporosis, right? But it tends to affect the bones around your joints and the ones in your spine. So thoracic spine, or the spine part in your chest and in your lower back, those tend to be the ones which are affected by osteoporosis. And it's important, but sometimes they can happen without you even falling, without you even sustaining any type of injury, right? So the spine, definitely very high up there. We see a lot of osteoporotic type fractures in the spine. Outside of the spine, the most common areas we see osteoporotic fractures is around the hip.
Okay.
So either the neck of the femur, as I mentioned, or the intertrochanteric area of the femur, or in other words, just the top part of the femur around the hip. Then also the wrist. So the lower part of the radius bone where it meets the carpal bones, or what we call the distal radius. It's an extremely common area for fractures. And the reason why these are the most common areas, because if you fall or you slip, or you fall onto an outstretched hand, right?
Yeah.
And if you or I fall, hopefully you and I, we won't sustain a fracture because our bone is strong enough. But in somebody with osteoporosis, right, the bone cannot withstand that force. And so as they fall, they tend to put a lot of force onto the wrist, and then they sustain a fracture either from the bending force or from the shearing forces of the carpal bones into the wrist. Around the hip, as you age, if you're not doing a lot of resistance training, and your muscles undergo what we call sarcopenia, where you have loss of, which is basically the equivalent of osteoporosis in your muscles. So sarcopenia, osteoporosis go together. Then you have less padding around them of the bones, and so your ability to fracture the bones is much less after like a simple fall, maybe and commonly it's it happens around the house on a loose carpet or in the bathroom on a wet floor, for example. And in really bad cases of osteoporosis, all it takes is a bit of a turn, right? So you turn in a bit of a, not even a forceful manner, and the torsional force is too much on the bone, and you actually break the bone and then fall, as opposed to the other way around where you fall and then break the bone.
Okay.
Right. So those are the most common ones. But the other ones that we do definitely see, and we're starting to see more and more osteoporotic fractures, especially since now medical science has grown to where patients are just growing older. It's not unusual to do surgery on an 80, 90-year-old anymore, because patients are just living longer, right? So around the shoulder, what we call proximal humerus fractures, also very common. Around the elbow, distal humerus fractures, and then even around the ankle area, the knee is also an area where you can get osteoporotic fractures. But certainly, by and large, I think the hip, the distal radius, and the spine are the most common areas where we get osteoporotic fractures.
Okay. Assalamu alaikum wa rahmatullahi wa barakatuh, Doc. I have osteoporosis and am on 112 35 milligrams. I take it once a week. What are the side effects of this medication? Jazakallah khairan. You got the question?
I got the question. What was the medication they're on?
112 35 milligrams.
Bontavir. I'm sorry, I'm not familiar with the medication.
Okay.
Yeah.
Well, that was the question. So, if you're
like I said,
familiar,
as orthopedicians, we deal with the symptoms of osteoporosis.
Okay.
We don't necessarily treat osteoporosis.
Okay. Now, I think we've got like a minute before we take the ad break. I think we'd rather take the ad break because otherwise Dr. Manja will take us right to 10 to. So, this is the marketplace. Will continue on the other side of this, inshallah.
There are over 200 million orphans globally. We can't help all of them, but what if we each helped just one? The Al Imdad Foundation now gives you an opportunity to help just one orphan from Syria or Palestine. For just 500 Rand per month, you can help safeguard the dignity of an orphan by assisting them with basic needs such as food, clothing, shelter, medical care, and attention. Our orphan sponsorship program allows you to track the progress of your orphan through regular feedback. Make a difference in the life of an orphan today. Visit alimdad.com or call 0861 786 243 for more information.
Are you or a loved one battling the disease of addiction? Is your family, life, relationships, work suffering due to alcoholism and substance abuse? Zensai Treatment Recovery and Wellness Center are addiction specialists offering specialized psychotherapy and naltrexone therapy to help overcome addiction. Zensai offers hotel-style facilities to allow your loved ones to regain their dignity and overcome alcoholism and drug abuse in the most comfortable setting possible. Fight addiction. Call Zensai Treatment Recovery and Wellness Center, the addiction recovery specialist on 031 563 0751.
Keeping with the summer breeze, we offer you a large range of fans, air conditioners, water coolers, and unbelievable prices. Check your local newspaper or our website www.bawasfern.com for our in-store unbeatable prices. From our appliance department, get the Media 20-litre microwave at 999. We offer you 43-litre electronic microwave at an unbelievable price of 1999. Bawas, we promise the best prices in town. If not, we will beat or match any price of any reputable dealer in town.
Bawas, where shopping is fun, and you are number one.
You're listening to Medical Files, brought to you by the Islamic Medical Association of South Africa and presented by myself, Faisal M.J. Suleiman. Our topic for discussion is osteoporosis and fractures, and our special guest, Dr. Mohammed Manjra, an orthopedic and arthroplasty surgeon. And Mohammed Manjra specializes in reconstructive, restorative, and replacement surgery of the hip and the knee. Now, Mohammed, a question has come in, says, Salams, how are you? Does doctor think that it's advisable for a lady of 78 to have a carpal tunnel operation?
Well, I mean, if you have carpal tunnel syndrome, it's a very debilitating disease where you have pain and you have compression of the nerve in your hand. And if you leave that compression long enough, it actually kills off the nerve and kills off the muscles in your hand. It's quite debilitating. And I think the listener's concern is her age. And as I just said, a few minutes ago, is that, if you're medically well for a procedure, age shouldn't really be a determining factor, because who knows how long you're going to live for. I mean, you may be 78, you may live till you're 88. Now, do you want to live 10 years of agony and pain, or do you want to live 10 quality years? You understand what I'm saying? And it's not uncommon that we see patients who, in the sort of 70s or 80s who probably needed a orthopedic procedure 10, 15 years prior, and they just never assumed they're going to live that long. And now they develop all host of medical problems because of their immobility. And now we kind of tell them, well, look, then you kind of decided you didn't want it because you felt you were old, but now you're even older, but now you're just too sick for surgery, And it's a really miserable way to spend the time of your life when you should be enjoying time with your grandkids and your families and sharing the wisdom in your old age. There's no need to sort of live in misery and pain.
Absolutely. I'm not sure if you answer the next question. It says, Salam's question is not related to osteoporosis, but can single injection be substituted with ganglia injection?
Single injection?
CINGAL?
Yeah.
Can this be substituted with ganglia, GANGLIA injection? Have you heard of it?
I'm not sure what ganglia injection is. That doesn't. So ganglion is a cyst on your wrist. A single injection is a injection that we use for osteoarthritis in the knees. So that's, as I mentioned before, osteoarthritis is a disease which affects the joints. So it's a degenerative condition of the cartilage inside your joints. So we do use single injections in select patients. And what single injection has, it's a mix of a corticosteroid, which helps with inflammation and pain, and hyaluronic acid gel, which is the normal fluid which exists within your knee. And it's a delaying tactic that we use, for want of a better word, before a patient undergoes knee replacement. So maybe if they're quite young, they're not ready for surgery, they're not medically well for a knee replacement, we would use things such as single injections or Monovisc or PRP or steroid injections, just to sort of tide them through and help them with the pain before they are ready to undergo knee replacement surgery, which is the gold standard for knee osteoarthritis.
Okay, coming back to our questions, Doc, is how do osteoporotic fractures differ from regular fractures?
All right. So as you can imagine, right, when something is brittle or less dense, when it breaks, it shatters more, right? And I think that's the best way to describe osteoporotic fractures, that it's more brittle. And when you look at it, the X-ray can sometimes be very dramatic because there's little bone shards lying all over the place. You understand what I'm saying? And so I think that's how they differ from your typical fracture. So, for example, somebody who's involved in a motor vehicle accident or a sporting injury, they tend to get what we call a clean break, so just a transverse or an oblique fracture. When patients get osteoporotic fractures, these tend to be what we call very comminuted fractures, or very lot of small little pieces that you have to put together. And that can sometimes pose quite a significant challenge to the surgeon. Yeah.
060-904-1056. We've got like about 8 minutes left for the program. If you have any questions for Dr. Mohammed Manja, you may forward them to us via WhatsApp on 060-904-1056. Now, Dr. Manja, what are the consequences of osteoporotic fractures beyond the immediate pain and discomfort?
Right. So this comes down, mainly to the patient population which osteoporotic fractures involve. So these are elderly population, and they're very vulnerable to immobility and lying in bed. If you put an elderly person in bed for 24 to 48 hours, or sometimes even less, they become confused and sometimes bedridden, and it takes a long time for them to get out of bed.
Okay.
So osteoporotic fractures, especially in the lower limb, can result in loss of independence and the complications we mentioned before. And even if they're stuck in bed for a long time, they can develop urinary tract infections, chest infections, bed sores, all these things. So our objective as orthopedic surgeons in managing osteoporotic fractures, and we do this in conjunction with our colleagues who manage the osteoporosis itself, the rheumatologists and endocrinologists, is to restore mobility as soon as possible.
Okay.
Because we want to avoid the complications of lying in bed for too long, so to say. Yeah.
Now, can osteoporotic fractures be prevented, and if so, how?
So, like I mentioned, comes to the point we mentioned, is to prevent osteoporosis in the first place is to treat it and also follow a healthy diet, etc. Now, so if somebody, say somebody who's got osteoporosis, if you know you've got osteoporosis, I think you need to take extra care, especially around your home. So what I tell patients is that firstly, no rugs around the bed, around the coffee table, etc. You don't want random coffee tables and chairs lying around. You want a very sort of clean, sort of minimalist home, right? So that's the first thing. You don't want anything that's going to cause you to fall, right? The second thing is why patients commonly fall and develop these fractures is that they can't see, So, if, sometimes elderly patients need to go to the bathroom quite often during the night. So either have a well lit up, passage to your bathroom, or have a torch close to your bed so that you can actually see where you're going and make sure that you don't step onto something and fall, like a rug, whatever. And simple things like making sure that you have non-stick or rubberized mats around your bathroom so that you don't have slippery surfaces to fall on, etc. And those are the main things. Those are the main things that you can just to prevent the fall. That you do and that's simple things you can do around the house. Yeah.
Okay. Salams to presenters all at radio and Al Ansar and Dr. Manjra. I'm 68 years old. My parents did have osteo issues, etc. I developed a left leg vastus lateralis pain.
Yeah.
This yesterday, all I know, I was forced to get out of the passenger side door of my van on Sunday because someone parked very closely at complex, and I could not get out the driver's side door. Otherwise, I do have gout and had been sleeping with a hot water bottle on this thigh the same day after getting out of the van. Jazakallah, Frank. You got the question?
Yeah. So I think in a nutshell, it's got a pain in the muscle, the thigh. Yeah, I mean, look, a lot of the times these things will. It depends how if the pain is so bad where you're lying in bed, I would suggest maybe at least getting some medical attention and getting the X-ray done to make sure you didn't break a bone. But if you just got some muscular pain, you can give it a couple of days with some pain meds, anti-inflammatories, and you can get a physiotherapist to come and see you and just help with the muscular pain. And then if it doesn't settle down, then seek medical attention. So it just depends how bad the pain is, whether you can walk. If you are getting around, you just got some discomfort, you can try some medication and physio. If you can't get around, definitely get medical attention, at least get an X-ray.
Okay, the next question comes. Who do you go to for osteoarthritis and osteoporosis?
Right. So osteoarthritis, for the most part, is treated by orthopedic surgeons, especially when it occurs around the hip, the knee, the shoulder, the spine, the hands, etc. It's typically treated by orthopedic surgeons. Well, that's partly true. We treat sort of the more advanced stages of disease. So, you know, what we do is we can offer you injections and we can offer you surgery, so needles and scalpels. But I think it's also, you know, even if you have mild to moderate disease which doesn't require an injection or surgery, it's important to get a diagnosis. So we can help you to make the diagnosis, and then, you know, if it's still early disease, you know, we can advise you on non-surgical treatments that are available, you know, whether it be physiotherapy, occupational therapy, biokinetics, chiropractors, whatever the case is, we can advise on those different things. And then you can also stage the disease and then decide on, you know, sort of a game plan for, you know, for your next 5 to 10 years, wherever, and the type of activities you want to be involved in and how we can keep you moving. Because that's what I love doing, is I love keeping patients moving, keeping patients active. You know, a lot of my patients are very active sportsmen, etc. And I want to keep them moving, whether it's cycling, paddle, you know, mountain biking, whatever the case is. I love them sending me pictures of them returning to their sports and to their activities. And for me, it's very rewarding because I'm somebody who also enjoys those activities, right?
Mm-hmm.
When it comes to osteoporosis, you know, definitely you can either see, you know, one of our endocrinologists or rheumatologists at Ahmad Al Qadi that specialize in treating osteoporosis. Yeah, like I said, when it comes to osteoporosis, we don't treat the condition as much as we actually treat the fractures and the complications of it.
Mm-hmm. Okay, you've got like 2 minutes. I will talk to you about something that you enjoyed today.
Yeah.
And advance in technology, etc.
Right.
I think you did something called robotics.
Yeah.
Robotic surgery. What is it?
Yeah. So
you've got a minute to talk to me about.
A minute. Okay. So a bit off topic. So
I know off topic, but I think it's what the excitement was.
So if you look at the healthcare space at the moment, it's exploding with newer technologies and innovative ways of how we can help patients. So whether it's actually doing the procedures, whether it's educating patients about their conditions or assisting in their follow-up, it's exploding. And I think as young orthopedic surgeons, we have to embrace this technology in a responsible manner. So once the data has been established that we embrace these things and we use them in the correct manner, not so much just to for marketing, but definitely because we want to benefit patients. So as you know, as you mentioned, I specialize in, one of my expertise is joint replacement surgery. And I perform what we call robotic knee replacement surgery. And so what this involves is we have a surgical robot. There's various systems on the market. I've been certified in 2 of them. And what the robot does is, it's just slightly off topic. A patient came to a colleague of mine and said, can you assist the robot to do my knee replacement? And we had a good laugh about it, but it's actually the opposite. So the robot assists us in performing these joint replacements.
Okay.
And what it does is, instead of us using manual instrumentations and just sort of, feel to assess where to make our cuts and balance the knee replacement, we have real-time data using various landmarks and sensors on the patient's body, feeding into a machine, and we have a screen where we can adjust where to make our cuts onto the bone. That then the robotic arm is then sort of automatically placed onto the bone. We are able to make our cuts and then perform the surgery with a lot more precision and a lot more guidance and enhancing patient outcomes.
Excellent. Unfortunately, that's all we have time for, Dr. Majid. Jazakallah khair for joining me on the program. Absolute pleasure talking to you.
Always
And thank you for joining me. And thank you to all the listeners and the various engineers at the various radio stations that have been engineered, right? Thank you so much. And shukran for tuning into Medical Files. From myself, Faisal MJ Sulaiman. Till we meet again, it's Assalamu alaikum wa rahmatullahi wa barakatuh.
An informative Islamic